Well, good morning. We are certainly going to continue with a very interesting, this very interesting conversation that has already started, and with Dr. Hank Levin and Max Crowley. We'll first start with Dr. Levin. He is the William Hurt Kilpatrick Professor of Economics and Education at Teachers College, Columbia University. He is the director of the National Center for the Study of Privatization in Education and co-director of the Center for Benefit Cost Studies in Education. He has written numerous books on the subject. So we have an expert on the topic here. We are lucky to have you. Go ahead.
Thank you very much. My presentation actually is going to be very simple because I'm only going to deal with only three themes. The first is one I think that has already come out, which is the inadequacy of most cost analyses. Second is what method should be used. And the third is creating a civil union. And I'll let you think about that for a little while, okay?
That's good for right before lunch, don't you think?
Not bad. Let me begin by saying, where are the costs? And if we look at the literature, we use calipers to measure effectiveness, and we use witching rods to measure costs. Why? Well, I'll come back to the why in just a minute, but let me just elaborate on this a little bit. In many studies, the costs are ignored completely. And interestingly enough, economists are the worst violators here because we're so excited about finding effectiveness results, that the calipers, well, we have regression discontinuity, and we have IVs, instrumental variables, and propensity score matching, which is not getting quite as good a reputation as it once had, and difference in difference, and of course RCTs, the gold standard. You ought to read Nancy Cartwright, famous philosopher of science, on that claim. It makes her angry. But anyway, the important point is that it's so exciting to find effectiveness results that here economists, costs are just ignored. But not only economists, of course, others as well. A lot of times we find the costs are presented. In fact, we looked through the health and the medical literature, and the costs were presented with no source and no mention of criterion. Costs taken from the budget. Well, as you can see, I'm kind of critical of that, as I mentioned, because we have to separate out what the true costs are and then how they're financed. And the budget is not necessarily a full or accurate a metric for determining what those costs are. In some of these studies, you just get the accounting department told us, particularly in hospitals, and then, of course, they use administered prices. God knows what those data mean. And then there will be others who say grant support. There's one study that has 17-to-1 benefit cost ratio, and all they use is funding from the central organization that sends money to the communities that have adopted this particular intervention. They don't look at all at the real resources that are being required. So it's a situation in which we could say benefit, cost, or cost effectiveness, because there's so little attention given to cost, and particularly in a systematic and rigorous way. So we could ask some question, what is the criterion for determining costs? We ought to have, again, I like the idea of standards because we can work towards them. They're not going to be easy, but I think that there are some standards that we can use to answer that question. How complete should the cost be? And we argue that it must cover all of the requirements that obtained the effects. Look at it this way, whether it's take Perry Preschool. Now, I have to, full disclosure, I'm on the board of High Scope, so anything that I say favorably, add a little discounting. I don't know what the rate will be, but yeah.
Cut it by 50%.
But in fact, I agree that we should have replications at Perry. I mean, we have basically one study, and the thing that you did not say, Brooke, was that if we eliminated males from the study, there's really a question of whether the benefits exceed the cost, because it's those males that are really bad and get involved in the criminal justice system. And if you look at the totality of benefits, it's male crime that dominates them. But the important point here is this. If we think conceptually, here we got an effect size, let's say, and we got this along several dimensions. We have to answer the question, what resources did it take to get that effect size? Because we want to replicate that result, as opposed to, gee, what did it cost? We need to know concretely what was there, what was in place. I would go farther, in fact, I will in just a moment, in terms of understanding the intervention. Another question, does it use comparable prices for comparison? I've seen studies that compare different things, and they have just local prices, some in a rural area, others in an urban area. Well, that's standards. The comparability isn't there. What we need to do is to use some set of prices that do not discriminate against high cost in one area versus others, because that's not intrinsic to the intervention. And then the question, is the constituent information adequate for an observer to replicate the results? Now that goes, again, none of these are strictly cost questions. Those go to both sides of the ledger. We use what we call the ingredients cost method. It's just a fundamental economics approach, okay? And our criterion is a single criterion that we try to meet, and that is the economic opportunity cost, which I think most of you know technically means the value of resources and the best alternative use. We're using them this way. What are we giving up? What are we sacrificing? We use competitive market prices or shadow prices largely based on the market. And we could go into detail on that. And the goal is to ascertain the cost of all of these resources using the economic opportunity cost criterion required to replicate the effectiveness result that we see. What are the major steps? Well, for each alternative that we're comparing, we want to start off with a description of the intervention and the theory of action. It's very important on the cost side to understand what was being attempted and why, and how did it take place. I should add as a footnote that most studies don't provide very much detail on that at all, which is a real difficulty if you want to do good cost analysis. Secondly, you want to specify the ingredients or the resources that were used to implement the intervention, both in quantity and quality, and irrespective of how they're being financed. We consider a volunteer as being self-financed, for example. But you simply can't say, well, that was free. There was no cost to that, because in another setting, you're going to have to provide that at the market cost for that particular input. And so we're very concerned for that. And how do we get this information? Well, documents, interviews, observations, I should say, if you can, because if you're trying to get cost for something in the past, there might not be any observations. It's interesting how short-lived a lot of these interventions that allegedly showed results, but they disappear. And that's interesting in itself. Why? Interviews, people who were involved with them, who worked on them, and documents, and archival documents, again, as I've mentioned, often they don't have a lot of detail. we can solve that one. Okay, and then we use market or shadow prices for all ingredients based on opportunity costs. We do this independently of the funding sources, and funding is not just money, it's resources in kind, such as volunteers. And then we analyze the costs in different ways to make them amenable for analysis and comparison. This is, I'm going to show this very quickly, but this is an example of a cost worksheet where in column 1 you have the ingredients. Of course, these are Excel sheets and they can go on for miles if you want. Column 2 is where we put our pricing, what these resources cost in terms of their social value, opportunity cost, and then what we do is we divide them according to different constituencies who are paying for them, and you can later match this up if you have good data on effectiveness for each of these constituencies or benefits. And we include the cost to students and parents. Again, including things like transportation or other kinds of things, but only when we get to the bottom do we make adjustments for the financing so that, for example, if we charge students and parents in part for the program, there's a plus there, but in terms of the student sponsor, there's a minus. You probably can't see it because it looks vague to me, but there's a minus. That is, you reduce the finance cost to the sponsor, and you can do a thorough analysis and come up with the financing too. Now, this method has been published, and I'm going to show you. We've been using it for 40 years. It's a long time ago, and we produced quite a few studies using this method over these decades. I also want to offer an alpha version of the computer platform because we have an Excel-based computer platform with the method, with the user manual, and we have, I think, 131 indexes of a database of prices and other data, as well as, of course, discount rates, et cetera, et cetera, et cetera. And we are now working on a beta version, so we would love people to use it so we can get feedback on how we could improve this. And this seems to be accepted by economists in the sense that over those 40 years, we've published quite a few of these, and we haven't had criticisms on the cost. And it's been adopted by the Poverty Action Lab at MIT to do cost effectiveness of its RCTs. Well, see, we're right near the end. Civil union. Well, you can read number 1 yourself, but we would like to set a standard for cost analysis that's equally, I say amorous because that civil union thing has been in the news lately on amorous relationships, but I would say, I will use the word rigorous with both effectiveness and benefits analysis. That is, instead of costing being an afterthought, oh, we got the effectiveness, we got the benefits, looking at the two of them as being closely related and doing these two simultaneously. This is the second thing, that as long as you do it after the fact, you lose a lot of information, which is necessary to get proper costing. And so we see this, I see Rebecca Maynard here, because we've talked this over many, many times. We see this as being built in to evaluation studies. So both are done. Now there's another reason, and that's number 3. I never thought I would say this about qualitative analysis, but I think we really need it in this case, people who are well-trained, who are very systematic. I know qualitative analysis covers a wide variety of sins and blessings. And I'm talking about the blessings, okay? And we need in our evaluations careful study of what actually happened at a site, not just the theoretical picture, but what actually happened. And I would argue that that's also important for understanding these large differences in site results, because in our analysis, particularly in our most recent studies done trying to do cost effectiveness of the What Works Clearinghouse results, we found ungodly variance in terms of results from site to site, but an effect size, an average effect size. Some average, what does it mean to know the effect size was 0.21 when it goes from minus 0.05 to plus 0.40? Well, we think some of that has to do with the resources, some of it has to do with the implementation, whatever resources were used. By having a person or persons or whatever, some capacity to do this ethnographic analysis at each of the sites, and it doesn't mean a full-time person at each site. We're not talking about, building up. We think that this can be done parsimoniously with periodic visits and data gathering. What we can do is get a much better picture of the intervention process and the ingredients, and knowing the intervention process, that's also going to be helpful on the benefit side or the effectiveness side. And this can also, we think, explain a lot of the differences in site results beyond costs. And we believe that what we really have to do is to avoid retrospective cost analysis as much as possible. Sometimes it's necessary because we're not sure that something is going to have the kind of effectiveness that we need. But once we find that, we need to have kind of trigger information. Go after that. Don't wait 5 years. Don't wait 10 years. In some cases, with the What Works Clearinghouse, the studies were 20 years old, and you have to go to cemeteries to interview the observers there, okay? So these are our suggestions. I've tried to shorten things because having worked on this for so many decades, you just pile up suggestions, informations, ideas, and things like that. But these are the three essential ideas that I would have. And I like the idea that we follow the standards concerns because I do think that these need to be part of the standards discussion. Thank you very much.
Our next presenter is Dr. Max Crowley. He's a prevention scientist and health policy researcher. He is an NIH Research Fellow at Duke University and a Research Fellow at the National Bureau of Economics Research. He's received multiple awards for his scholarship and currently co-chairs the Society for Prevention Research Task Force on Economic Analysis of Prevention.